Good morning. Today we will discuss one of the most important topics in preventive medicine, healthy lifestyle and wellness. As first year medical students, many of you are beginning a journey that will eventually lead to caring for patients. However, before we can effectively advise our patients, we must first understand how to care for ourselves. Throughout this lecture, we will discuss what health really means, why lifestyle is one of the strongest determinants of disease, how proper nutrition promotes wellness, and why periodic health examinations are essential even for apparently healthy individuals. Remember this quotation: patients are more likely to follow advice from physicians who practice what they preach. By the end of today's lecture, I hope you will not only understand the concepts, but also reflect on your own lifestyle. Let's begin by looking at our learning objectives. At the end of this lecture, you should be able to first define health, wellness, and healthy lifestyle. Second, describe the major components of a healthy lifestyle. Third, explain the principles of proper nutrition and healthy eating. Fourth, discuss the importance of periodic health examinations. Fifth, identify preventive health recommendations across different stages of life. And finally, apply wellness principles to your own personal and professional development. Notice that these objectives progress from knowledge to application. Our goal is not simply to memorize facts, but to learn habits that will benefit both ourselves and our future patients. Which objective do you think will have the greatest impact on your own life as a medical student? You might ask, why are we discussing lifestyle in medical school? The answer is simple. Physicians have one of the highest rates of stress, burnout, depression, and lifestyle related illnesses. Ironically, many healthcare professionals neglect their own health while caring for others. As future physicians, you should practice what you preach, serve as healthy role models, and help prevent chronic disease. Maintain physical and mental well being, reduce burnout, and prolong your professional career. Benjamin Franklin once said, "An ounce of prevention is worth a pound of cure." This statement summarizes the philosophy of preventive medicine. The healthiest physician is often the most convincing advocate for healthy living. If a physician smokes while advising patients to quit smoking, the message loses credibility. When people hear the word health, they often think only about the absence of disease. However, according to the World Health Organization, health is a state of complete physical, mental, and social well being, and not merely the absence of disease. This definition reminds us that health is multidimensional. Let's briefly discuss these dimensions. Physical health refers to proper body function. Mental health involves thinking, learning, and decision making. Emotional health concerns our ability to recognize and manage emotions. Social health reflects healthy relationships. Spiritual health gives meaning and purpose. Environmental health considers our surroundings. Occupational health relates to satisfaction and safety in work. As physicians, we should evaluate patients from all these dimensions rather than focusing only on laboratory results. Can someone be physically healthy but mentally or spiritually unhealthy? What do you think? Health is not a fixed condition. Instead, imagine a line. On one end is severe illness, on the opposite end is optimal wellness. Every day we move somewhere along this continuum. Our position changes depending on our choices and circumstances. Several factors influence this movement: lifestyle choices, genetics, environment, healthcare access, social determinants of health. Some factors cannot be changed, such as genetics. However, many important factors like diet, exercise, sleep, and smoking are modifiable. This is why lifestyle medicine has become increasingly important. A person with a family history of diabetes may never develop diabetes if healthy lifestyle behaviors are maintained. So, what exactly is a healthy lifestyle? A healthy lifestyle is a pattern of behaviors that promotes health and reduces disease risk. Notice the phrase pattern of behaviors. Healthy living is not about making one good decision today, it is about consistently making good decisions over many years. The six major components include balanced nutrition, regular physical activity, adequate sleep, stress management, avoidance of harmful substances, preventive health care. Think of these as the pillars supporting long term health. If one pillar becomes weak, overall health begins to suffer. Worldwide, most deaths are now caused by non communicable diseases or NCDs. These include hypertension, diabetes, stroke, heart disease, cancer, and obesity. What causes many of these diseases? Four major behavioral risk factors, namely tobacco use, alcohol use, physical inactivity, unhealthy diet. Notice something important? All four are largely preventable. This means that many chronic diseases are preventable before medications are ever needed. If someone has hypertension, should treatment focus only on medication? No, lifestyle modification remains the cornerstone of management. Okay. Non communicable diseases account for most adult deaths worldwide, including in the Philippines. The major diseases include heart disease, stroke, diabetes, chronic respiratory disease. These illnesses not only shorten life expectancy but also reduce quality of life and increase healthcare costs. Fortunately, many are preventable through lifestyle modification. As future physicians, your greatest contribution may not be prescribing medicines, it may be preventing disease long before they actually develop. Healthy living can be summarized into five pillars: healthy eating, physical activity, adequate sleep, stress management, and preventive care. Notice that preventive care is included. Many people think healthcare begins only when they become sick. Preventive medicine teaches the opposite. Healthcare begins while you are still healthy. Let's now focus on the first pillar, nutrition. Okay. Nutrition is the process through which the body obtains and uses nutrients for growth, maintenance, and overall health. Nutrition has several essential functions. It provides energy, supports tissue growth and repair, strengthens immunity, regulates metabolism. Every organ in the human body depends on adequate nutrition. Poor nutrition contributes to infections, delayed healing, poor academic performance, and chronic disease. For example, a medical student who frequently skips meals may experience fatigue, poor concentration, and decreased academic performance. Macronutrients are the nutrients our body needs in large amounts. These include carbohydrates, proteins, and fats. Carbohydrates provides our primary source of energy. Proteins support growth, tissue repair, and enzyme production. And fats are essential for hormone production, energy storage, and absorption of fat-soluble vitamins. A healthy diet requires balance. Neither excessive carbohydrates nor complete avoidance of fats is healthy. Instead, appropriate proportions are recommended. One common misconception is that all fats or all carbs are bad. In reality, healthy fats, such as those found in fish, nuts, and olive oil, play essential physiological roles. The body is optimized for consuming carbohydrates for a reason. And indeed, carbohydrates are an essential part of the daily functioning of the human body. Unlike macronutrients, micronutrients are required only in small amounts. However, they are absolutely essential. These include vitamins and minerals. Examples include vitamin A for vision, vitamin D for bone health, vitamin C for wound healing, iron for red blood cell production, calcium for bones, iodine for thyroid function, and zinc for immunity. Micronutrient deficiencies remain an important public health concern in many countries, including the Philippines. For example, iron deficiency, anemia, continues to affect many women and children. As physicians, we should recognize that proper nutrition involves both adequate calories and adequate micronutrients. We have now established the foundations of healthy living by discussing the concepts of health, wellness, healthy lifestyle, and nutrition. In the next section, we will continue with practical dietary recommendations, the Pinggang Pinoy model, physical activity, sleep, stress management, and wellness. These are the lifestyle habits that every future physician should model and teach the patients. Okay, now that we understand the nutrients our body needs, let's discuss how these recommendations are translated into everyday meals. In the Philippines, we use the Pinggang Pinoy model developed by the Food and Nutrition Research Institute. Instead of counting calories or memorizing complicated diets, Pinggang Pinoy provides a simple visual guide. Half of your plate should consist of fruits and vegetables. One fourth should contain whole grains or healthy carbohydrates, such as brown rice or whole wheat products. The remaining one fourth should contain lean protein sources, such as fish, chicken, beans, or tofu. The amount of protein should be equivalent to roughly the size of your palm. Finally, water should be your beverage of choice. Notice that vegetables occupy the largest portion of the plate. This reflects their importance in providing vitamins, minerals, antioxidants, and dietary fiber. Look at what you ate for lunch today. Would it fit the Pinggang Pinoy model? Okay, let's apply the healthy plate model to a practical meal. Imagine a lunch consisting of grilled fish, 1 cup of brown rice, sauteed vegetables, a banana, and water. This meal contains lean protein from the fish, complex carbohydrates from brown rice, vitamins, minerals, and fiber from vegetables and fruit, water instead of sugar sweetened beverages. Now compare this with a meal consisting of fried chicken, large fries, soft drinks, and dessert. Although both meals may satisfy hunger, their nutritional value differs greatly. Healthy eating is not about eating less, it's about eating wisely. Patients are often surprised to learn that replacing sugary beverages with water alone can substantially reduce daily caloric intake. Healthy dietary recommendations can be summarized into two simple ideas: eat more of healthy foods, eat less of unhealthy foods. Choose more fruits, vegetables, whole grains, fish, legumes, water. Limit added sugar, salt, saturated fats, and highly processed foods. Remember that no single food is completely good or bad. The overall dietary pattern matters much more than occasional indulgence. Moderation and consistency are the keys to long term success. What do you think is the biggest nutritional challenge among medical students? Maybe skipping meals, fast food, sugary drinks, and irregular eating schedules. Okay. As future physicians, you should know how to read a nutrition label. Patients often focus only on calories. However, several components are equally important. Always begin by looking at the serving size. Many people unknowingly consume 2 or 3 servings in one sitting. Next example, examine the calories, total fat, sugar, sodium, protein, and fiber. For example, a beverage may contain only 120 calories per serving, but if the bottle contains 3 servings, drinking the entire bottle means consuming 360 calories. This illustrates why serving size should always be checked first. If possible, hold up a bottled beverage or snack package, okay, and try to apply the lessons learned in this slide. Okay. Nutrition is only one component of healthy living. The second pillar is physical activity. According to the World Health Organization, adults should perform 150 to 300 minutes of moderate intensity exercise per week, or 75 to 150 minutes of vigorous exercise. In addition, muscle strengthening activities should be performed at least 2 days per week. Many people believe exercise requires a gym membership. That is not true. Brisk walking, cycling, climbing stairs, dancing, and household activities all contribute towards physical activity. Exercise should be viewed as a daily habit rather than a punishment for overeating. The benefits of regular exercise extend far beyond weight loss. Physical exercise improves cardiovascular fitness, helps maintain healthy body weight, strengthens immunity, reduces chronic disease risk. Mental exercise reduces anxiety, improves mood, enhances concentration, and improves sleep quality. As medical students, these mental health benefits may be just as important as the physical benefits. Research consistently shows that physically active students often experience better concentration and improved academic performance. What kinds of physical activity do you currently enjoy? Okay. Sleep is often the first healthy habit sacrificed during medical school. Unfortunately, this is one of the worst decisions we can make. Young adults require approximately 7 to 9 hours of sleep each night, and sleep is essential for memory consolidation, learning, emotional regulation, immune function. Remember that studying longer does not necessarily mean learning more. The brain consolidates newly acquired information during sleep, And without adequate sleep, memory formation becomes much less efficient. Sometimes the best way to improve examination performance is not another hour of studying, but actually another hour of sleep. What happens when sleep becomes inadequate? You may experience fatigue, poor concentration, impaired judgment, reduced academic performance, depression, hypertension, and obesity. In healthcare, sleep deprivation also increases medical errors. Many studies have demonstrated that physician fatigue negatively affects patient safety. This is one reason why physician wellness has become an important topic worldwide. A sleep deprived intern may overlook an abnormal laboratory result simply because fatigue impairs attention. Stress is inevitable in medical school. The goal is not to eliminate stress, the goal is to manage it effectively. Common stressors include examinations, heavy workload, time pressure, clinical responsibilities, family expectations, personal relationships. Stress itself is not always harmful. Short term stress can improve performance. However, chronic uncontrolled stress contributes to burnout, anxiety, depression, and physical illness. Since entering medical school, what has been your greatest source of stress? Healthy coping strategies help us manage stress without harming ourselves. Examples include regular exercise, adequate sleep, mindfulness or meditation, seeking social support, good time management, professional counseling when necessary. In contrast, unhealthy coping strategies include smoking, excessive alcohol intake, substance abuse. These behaviors may temporarily reduce stress, but ultimately worsen both physical and mental health. Remember that healthy physicians are not those who never experience stress. Healthy physicians are those who respond to stress appropriately. Okay. We now move beyond simply avoiding disease. This brings us to the concept of wellness. Wellness is an active process of making choices that lead to healthy and fulfilling life. Notice several important words: active, intentional, lifelong. Wellness is not achieved overnight, instead, it requires continuous effort throughout life. Every healthy decision you make today contributes to your future health. Wellness consists of multiple interconnected dimensions. These include physical, emotional, intellectual, social, spiritual, occupational, financial, and environmental. Think of these dimensions as the spokes of a wheel. If one spoke becomes weak, the entire wheel becomes unstable. For example, excellent physical health cannot completely compensate for severe emotional burnout. Likewise, financial instability may affect mental health, sleep quality, and relationships. True wellness requires balance across all dimensions. I would like each of you to rate yourself from 1 to 10 in terms of these dimensions. Which area needs the greatest improvement? Small changes today can produce major health benefits over the coming years. Okay, so far we have discussed how healthy lifestyle behaviors reduce disease risk. In the next section, we will focus on periodic health examination, why healthy individuals should still undergo regular medical evaluations, what components are included in PHEX, common screening tests, immunizations, and preventive health recommendations across different age groups. This is where prevention moves from theory into everyday clinical practice. Before discussing periodic health examinations, I want to emphasize wellness. Many physicians devote their lives to caring for patients while neglecting their own health. Unfortunately, this culture contributes to burnout, depression, and even suicide within the medical profession. Why is physician wellness important? First, healthier physicians provide better patient care. Second, physician wellness reduces medical errors. Third, healthy physicians demonstrate greater empathy and compassion. Fourth, wellness improves job satisfaction and professional longevity. Remember this important principle: you cannot pour from an empty cup. If you neglect your own health, it eventually becomes difficult to care effectively for others. As future physicians, caring for yourself is not selfish, it is a professional responsibility. Now let's discuss one of the foundations of preventive medicine, the periodic health examination, or PHEX. A periodic health examination is a routine medical evaluation performed even when an individual has no symptoms. Many people believe they should only visit a physician when they are sick. Preventive medicine teaches the opposite. The goals of a periodic health examination are to detect diseases early, assess individual risk factors, promote healthy behaviors, and prevent complications before they occur. For example, hypertension is often called the silent killer because patients may feel perfectly healthy despite having dangerously elevated blood pressure. Without routine screening, many diseases remain undetected until complications develop. The objectives of a periodic health examination can be summarized into five major goals. First, disease prevention. Second, early diagnosis. Third, risk assessment. Fourth, health counseling. And finally, updating immunizations. Notice that several of these goals occur before disease develops. For example, counseling a patient to stop smoking before emphysema develops is far more effective than treating advanced chronic lung disease. Likewise, administering vaccines prevents disease altogether rather than treating infection afterwards. This is the essence of preventive medicine. Can anyone give another example of prevention that occurs before disease develops? Okay, answers would include vaccination, healthy diet, exercise, and smoking cessation. A complete periodic health examination has three major components. The first is a comprehensive history. This includes the medical history, family history, lifestyle assessment. The second component is the physical examination, which would include the vital signs, anthropometrics, height and weight, body mass index, and the general systems examination. Finally, appropriate screening tests are performed based on the patient's age, sex, and individual risk factors. Notice that not every patient requires the same investigations, but preventive care should always be individualized. For example, a healthy 22-year-old medical student does not require the same screening tests as a 60-year-old patient with hypertension and diabetes. What screening tests are commonly performed during routine examinations? These would include blood pressure measurement, body mass index, blood glucose testing, lipid profile, mental health assessment, visual screening. Each of these identifies important health problems before symptoms appear. For example, elevated fasting blood glucose may reveal prediabetes years before diabetes becomes clinically obvious. Early detection allows earlier intervention and better long-term outcomes. Remember that screening tests are performed in asymptomatic individuals. Once symptoms appear, we are no longer screening, we are evaluating disease. When many people hear the word immunization, they think only of childhood vaccines. However, immunization is a lifelong process. Important adult vaccines include influenza, hepatitis, tetanus diphtheria, human papillomavirus, and COVID-19. Vaccination is one of the most cost-effective public health interventions ever developed. Vaccines protect not only the individual but also the community by reducing disease transmission. As future physicians, always review a patient's immunization status during preventive health visits. All right, preventive healthcare changes throughout life. Recommendations depend upon age, sex, family history, lifestyle, occupation, individual risk factors. Our goals remain the same: promote health, detect disease early, prevent complications, and improve quality of life. This is why preventive medicine follows patients throughout the entire life course rather than focusing on a single disease. For healthy young adults, preventive care focuses primarily on health promotion and early risk detection. Recommended assessments include blood pressure measurement, BMI, mental health screening, vision examination, dental prophylaxis, lifestyle assessment, vaccination review, health counseling. Counseling should include nutrition, exercise, adequate sleep, smoking cessation, responsible alcohol use, sexual health. Notice that counseling occupies an important place in preventive care, and education itself is a medical intervention. Okay, for young men, several additional preventive measures deserve attention. Cardiovascular risk assessment, which would include your blood pressure monitoring, lipid screening when appropriate, diabetes screening for high-risk individuals, sexual and reproductive health counseling, screening for sexually transmitted infections in high-risk individuals, and mental health screening for anxiety and depression. Remember that young adults often consider themselves healthy and therefore rarely seek medical care. Preventive visits provide valuable opportunities to identify unhealthy behaviors before chronic disease develops. For young women, preventive care includes several additional components: family planning, preconception counseling for couples, cervical cancer screening. Women aged 21 to 29 years should undergo pap smear screening every 3 years according to current recommendations. Between ages 30 and 65, HPV testing and or pap smear may be recommended depending on local guidelines. Breast health should also be discussed. This includes breast awareness and clinical breast examinations when appropriate. These interventions have contributed significantly to reducing cervical cancer mortality through early detection. As individuals enter middle adulthood, preventive care expands. Routine recommendations include blood pressure screening, diabetes screening, lipid profile, weight management, eye examination, hearing assessment, cardiovascular disease prevention, and cancer screening. This is the age group during which many chronic diseases first become clinically apparent. Early intervention during this stage significantly reduces future complications. A patient with mildly elevated blood pressure at age 45 may avoid stroke 20 years later through lifestyle modification and proper treatment. For men between 40 and 64 years old, preventive care emphasizes cardiovascular disease and cancer prevention. Recommendations include blood pressure monitoring, regular lipid profile, and diabetes screening. Colorectal cancer screening beginning at approximately age 45 for average risk adults. Discussions regarding prostate cancer screening using shared decision making. Shared decision making means that physicians explain both the benefits and limitations of screening so patients can make informed choices. Remember that preventive care is not one size fits all. Individual risk factors always guide clinical decisions. Okay, we have now discussed preventive care from young adulthood through middle age. In this section, we will discuss the life course approach by discussing preventive health recommendations for older adults. Okay, as women enter middle adulthood, preventive care expands beyond general health maintenance to include cancer prevention, bone health, and menopausal care. One of the most important recommendations is breast cancer screening. Depending on individual risk factors, mammography is generally recommended between ages of 40 and 50. Another important consideration is osteoporosis. As estrogen levels decline during menopause, bone mineral density decreases, increasing fracture risk. Women should therefore receive counseling regarding calcium intake, vitamin D supplementation when indicated, weight-bearing exercise, and fall prevention. Cardiovascular disease also becomes increasingly important after menopause. In fact, heart disease remains one of the leading causes of death among women. Lifestyle modification, including healthy eating, regular exercise, smoking cessation, and blood pressure control, remain the cornerstone of prevention. Preventive care for women extends beyond reproductive health. Cardiovascular disease prevention deserves equal attention. Older adults require a comprehensive approach because aging affects multiple organ systems. Routine preventive care should include blood pressure monitoring, diabetes screening, hearing assessment, cognitive screening, fall risk assessment, vaccination review, medication review, and functional assessment. Notice that preventive care in older adults emphasize maintaining independence and quality of life rather than simply preventing disease. Our goal is not merely to increase lifespan, but to increase health span. For older men, preventive care focuses on preserving function and preventing complications. Key recommendations include cardiovascular risk reduction, medication adherence, physical activity, fall prevention, individualized prostate evaluation. Encouraging regular physical activity remains important regardless of age because exercise helps preserve muscle strength, balance, and independence. Remember that healthy aging is an active process. For older women, osteoporosis becomes a major concern. Recommendations include bone mineral density testing when appropriate, adequate calcium and vitamin D intake, weight-bearing exercises, fall prevention strategies, mobility preservation, and cognitive assessment. Hip fractures are associated with significant disability and mortality among older adults. Many of these fractures can be prevented through appropriate screening and lifestyle interventions. Let's summarize some important population-based screening recommendations. Cervical cancer screening for women aged 21 to 65 years old. Breast cancer screening for women aged 40 to 74, according to risk and guidelines. Colorectal screening beginning at age 45 for average risk adults. lung cancer screening for eligible high risk smokers, and prostate cancer screening using shared decision making for selected men. Notice that screening recommendations are based on evidence demonstrating that early detection improves outcomes while minimizing unnecessary testing. Can screening tests ever cause harm? What do you think about this? Vaccination does not stop after adulthood. Throughout adulthood, recommended vaccines may include annual influenza vaccine, tetanus diphtheria booster every 10 years, hepatitis B vaccine, human papillomavirus vaccine, COVID 19, pneumococcal vaccine for older adults and high risk individuals, herpes zoster vaccine for older adults. Vaccination remains one of the safest and most effective preventive interventions available in medicine, as future physicians always assess vaccination status during preventive care visits. Okay, this slide summarizes one of the most important concepts in preventive medicine. There are 5 levels of prevention. Primordial prevention prevents the development of risk factors themselves. Example, creating smoke free environments or promoting healthy school meals in order to prevent malnutrition, cardiovascular disease risk. Okay. Primary prevention prevents disease before it ever occurs. Examples include vaccination, smoking cessation, healthy diet, and exercise. Secondary prevention focuses on early detection and prompt treatment. Examples include blood pressure screening, pap smears, mammography, and diabetes screening. Tertiary prevention reduces disability and complications after disease develops. Examples include cardiac rehabilitation after myocardial infarction and diabetes foot care. Quaternary prevention protects patients from unnecessary medical interventions, overdiagnosis, and overtreatment. Examples include avoiding unnecessary imaging or inappropriate antibiotic use. These 5 levels summarizes the philosophy of preventive medicine. Intervene as early as possible. Lifestyle medicine is an evidence-based medical specialty that uses healthy behaviors as therapeutic interventions. Its 6 pillars are healthy nutrition, regular physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social relationships. Lifestyle medicine does not replace medications when necessary. Instead, it complements traditional medical care by addressing the root causes of many chronic diseases. For conditions such as hypertension, obesity, and type 2 diabetes, lifestyle modification often produces substantial improvements. The best prescription pad is often a healthy lifestyle. So let's apply what we've just learned. One is a 20-year-old first-year medical student. He skips breakfast, sleeps only 4 to 5 hours each night, rarely exercises, and consumes multiple energy drinks every day. Let's analyze his lifestyle. What unhealthy behaviors can you identify? These are poor nutrition, sleep deprivation, physical inactivity, excessive caffeine intake, and poor stress management. What health consequences might occur? These would include fatigue, poor concentration, weight gain, hypertension, anxiety, burnout, and increased cardiovascular risk. What interventions would you recommend? Recommendations could include regular balanced meals, 7 to 9 hours of sleep, regular exercise, reduced energy drinks, better time management, stress reduction strategies. This case reminds us that medical students themselves are often at risk for unhealthy lifestyles. Before we conclude, let's summarize today's lecture. First, health is multidimensional. Lifestyle choices strongly influence disease risk. Proper nutrition forms the foundation of good health. Wellness requires balance across multiple dimensions. Regular health examinations save lives through early detection. Prevention is always better than cure. And these principles will remain relevant throughout your medical education and your future practice. I would like to end with 4 questions. How healthy is your current lifestyle? Which dimension of wellness needs the greatest improvement? What behavior can you change this week? And finally, are you practicing today what you hope to teach your patients tomorrow? Knowledge alone does not improve health. Healthy choices do. Okay, these references are based on evidence from the World Health Organization, the Philippine Department of Health, the Food and Nutrition Research Institute, Centers for Disease Control and Prevention, the American College of Lifestyle Medicine, and the United States Preventive Service Task Force. I encourage you to read these references because preventive medicine is an evolving field, and recommendations may change as new evidence emerges. Thank you for your attention. Remember that preventive medicine begins with ourselves. As future physicians, our most powerful health intervention may not be the medicines you prescribe, but the healthy lifestyle you model for your patients. Thank you very much.